Hey everybody, we're back this week. This week I'm going to talk a bit about compression strapping. So once in a while I'll see this in gyms. I think I would see it more often than I actually do. Honestly, I thought this kind of was out there and everybody knew about it, and now I've been finding more and more that people have a lot of questions about this. So when to use compression straps around mobility and increasing range of motion for the Olympic lifts. Honestly, anytime. You can use this at any moment. What we use a lot of this for is right there pre-workout, within that 30 minutes right before a workout, anytime during it, and even during a workout. So say, hey, I'm having a rough time, my shoulder's really sore, upper arm area. I might even do this between sets. So what we're gonna talk about is actually lower body today. So one technique we use quite a bit for warming up is we attack this calf. So if you have some trouble areas and you have time, I recommend taking a compression strap and only using about 4 to 6 inches of the area you want to attack, right? For this movement, I'm actually gonna do my whole calf, and we do that quite a bit just for the warm-up. It's a little faster and it still gets done what we want done, but remember, you'll be most effective in like a 4 to 6 inch segment. So what we're gonna do is we're just gonna take this, and we don't wanna just put it on, I guess, passively, kind of, oh, it's snug, but it's not really doing much for us. We want to put it in tight. So you can see I'm kind of crossing over about halfway overlap, and I am putting a lot of stretch on this band, as much as I can bear. If you're having serious pain when you're doing this, take it off. But you want to get this on nice and tight, compressing that down. And then once you're down, leave a little bit of space to kind of hook it in, and then we're locked. When you have something strapped, go ahead and move around. So if you wanted to just go through squats, you could do that. What I'm gonna show you is a movement that we do pre-warm-up or pre-workout that really helps us out. So we get set and sees my back foot is down flat. I'm gonna take my hip, drive it to the right, and I'm gonna do this 10 times. Goal is to not let my foot twist or come off the ground in the back. So say I go 10 times in this direction, 10 times straight on, and then 10 times to the left. So obviously I've shortened this up quite a bit just for the sake of the time of the video, but once we go in that direction, you're also welcome to do some squats. You can do some toe raises, kind of just pushing yourself up. Move the muscle that you're attacking around. You want to shoot for 30 seconds to 2 minutes, no more than 2 minutes per se. And then when you take it off, you should experience kind of a rush of blood flow through that area that you had wrapped up. It should feel slightly lighter than it was. It should feel looser, kind of, I don't want to say floaty, but it should feel much more open. If you're feeling like it's going to cramp, if you're feeling like it's more discomfort than you started, you may have put this on too tight. So there is a bit of a balance, but more often what I see with athletes, they put it on too loose than too tight, but keep that in mind. Second thing we're going to talk about using this is really what other areas on the lower body for weightlifting it really helps. So right above the knee, all right, in that say 4 to 6 inch segment, that's a really good area to attack. We don't do on top of the joints per se. And I'm gonna tell you that we don't do it. I wouldn't recommend going on the joint or over the joint in kind of two places. I've seen athletes do that. I don't really think you're getting as much focus as you do in 4 to 6 inch segment around the joint. So if you have knee pain, say your knees crack a lot, hitting right above with this strap will open them up quite a bit. We've seen a lot of knees stop cracking as much, even if there's not pain or discomfort associated with the cracking. Other area is up in the hip. And to get up in the hip, you really have to get into the groin, right? 4 to 6 inch segment. But note, when you get up in here in this area, you really are cutting off that artery running down your leg. So you may only get 30 seconds to a little over a minute on that one before, hey, I gotta get this off my leg. So remember, if it's pain that you're feeling, you put it on too tight, take it off, but it's not supposed to be comfortable. There should be some discomfort as you move through this and open up that area. Other thing you can do this for is any of the videos I've shown you where we've been rolling out, say something's very, very tender. you can actually use this before you roll and you will desensitize the area. So keep that in mind. And the one thing I'm gonna ask you not to do is please don't try to use this on your neck. Okay, just don't do it, all right? But that's it. We're gonna go, well, next week I'll actually use some compression strap upper body, highlight the areas, especially the shoulders. We've talked a lot about that. And I've seen that probably be kind of the aha to a lot of athletes I travel and see when we do something up here and move them around, how much better it feels. So until next time.